Okay, so I wanted to introduce today to you guys to Alon Levy, who is the health coordinator for the Jerusalem African Community Center for 2 years now. And he started the second year as the health coordinator in the rights advocacy group. What's really special about having him here with us is because he's also a medical student at Hebrew University in Jerusalem. And so he really can understand our perspective and how we might want to see things. And I think that's really special to have someone who's at your level of training and not, some professor who doesn't really understand what you're talking about. So thank you so much to Alon for coming, and I'm going to turn it over to him.
Thank you, Rebecca. And I'm happy to be here and talk with you. As Rebecca said, I'm a third-year student at the Hebrew University of Jerusalem, and I hope that I'll be able to give you a perspective of a student, of a future physician, about what working with asylum seekers means for me, and how experiencing this type of work during my studying years could be beneficial for me at the future and for you as well, I believe. So we'll just start. I'm going to start with a short background about the community in Israel, the asylum seeker community, and then we're going to go through the main health issues, health topics that I think are important to know about. I'd be happy to answer any questions during the lecture. Feel free to stop me. You can wait until the end of the slide, or you can try and raise your hand, and I'll try to see you. Let me know if you can hear me well or not at any time of the presentation. So I think we'll start. So you could see the first slide, the health seekers. I do think that they're seeking for their health. It's not given to them quite easily in Israel, and we'll see how it comes into action. So just a couple of definitions to start with. I think that in Israel, the media, the government, the people, they have different terms for asylum seekers, for refugees. We're going to go through each of these definitions and understand the meaning of them, the context behind them. The main one that we're going to use is refugees, and the next slide will be dedicated for that. Asylum seeker, in a couple of words, is supposed to be a temporary state, a person that fled his country and gets into a new country, is asking for a refugee status. It's not supposed to stay that way for a long time. Israel is a different situation. Most of the refugees are still asylum seekers because their requests for refugee status is not tested. We might go through a few numbers just to understand, but 99% of the requests, 99%, a little bit more than 99% of the requests for refugee status are not being examined in Israel at all. So it's a difficult situation. Asylum seeker status doesn't give you any rights, except of some of the countries are allowed to stay in Israel without a deportation threat upon their head, but it's not giving you any rights. A work migrant is a migrant that came to Israel or any other country to work. Some of them are illegal, some of them are legal. I'm guessing that you heard about the Philippine community that come to Israel to work as elderly supporters and stuff like that. The Thai community that come to work at agriculture, and I think the most hard definition is infiltrator, which is very dominant in the Israeli media and government use. The word infiltrators started to come in use in Israel in the 1950s right after a couple of years after the independence of Israel, when a group that was called Fadayyuns, which are Palestinians that fled to mostly Jordan, came into Israel in order um, to fight, to kill Israelis. They were called infiltrators for infiltrating into Israel, and the term was not used for a couple of decades, of I don't know, 30, 40 years, 50 years. And then when asylum seekers started to enter through Egypt, through Sinai, in order to create to maneuver the public opinion about the refugees that come to Israel, they started to be called infiltrators, and it's a very dominant word in today's media. I think that, I don't know if most, but a lot of the Israelis are going to call them infiltrators. It's a very, I don't know if you can feel it, but it has a very bad, it's not a positive word, and it tries to affect how people think and feel about the refugees that enter to Israel. So these are the main definitions. We're going to go and talk about refugees now. So this is the part of the convention relating the status of refugees. We're going to read it and talk about a few points from it. So the term refugee shall apply to any person who, owing to well-founded fear of being persecuted for reason of race, religion, nationality, membership of a particular social group, or political opinion, is outside the country of his nationality and is unable, or owing to such fear, is unwilling to avail himself to the protection of that country. And it gives you certain rights as a refugee. We're going to go through several points, a couple of words that are being used. First one I want to talk about is the founded fear, which has been a point of discussion in many countries and situations. How do you prove the fear to be founded? Not very easy sometimes. What is fear? I mean, it's a very large word to use. That's the first point that I think that should be noticed. Second one that is interesting, in my opinion, is the membership of a particular social group. It's a very, large definition. What is a social group? How do you categorize a social group? It's been used in several occasions for the gay community, the LGBT community that was persecuted in countries and fled because of that. So it's a smart definition by the ones that wrote the convention, because it's evolving. New social groups are emerged every couple of years. So I think it's a smart and comprehensive thinking of how to frame new situations. So that's about that. Outside of his country, it's important. If you're inside your country and you're escaping from your village, from your town, you're not defined as a refugee. There's a different definition, which gives you certain rights, but it's not about refugees. And unable or unwilling to avail himself of the protection of that country. So there's two sides of it, the unable one and the unwilling one. There are situations when someone can be protected by his country, by an organization, but doesn't want to. A good example for that is Iraq and the fight that they have with ISIS. If an individual doesn't want to be protected by the Iraqi military because of his fear from ISIS, it's not that they don't say that they can protect him, but he thinks that they can protect him, so he's unwilling to be protected by them. So that's an example for that. And the rights that are given are work, education, freedom of movement, identification documents. Most of the refugees that escape from their countries don't have any documentation. They go through countries They are moved by people who take their IDs, and it's necessary. I don't know if any of us feel that in a daily basis, but when you go to school, when you register your kid to school, you need to show an ID of them. And if you don't have an ID, or if you don't have an ID, it's a difficult situation. It's in the basics. And health has a question mark because it doesn't specify a right for health, but other conventions and declarations do refer to health rights, such as the Human Rights Declaration, but no specific reference to health in this one. Any questions so far? Okay. So a couple of numbers that you can see. We'll talk about the meaning of them and why they look like that. You can see that the infiltrators that I put in this sign is because it's used in the official side of the Ministry of the Department of Interior Affairs. That's how they're being referred. You can see that no entries happened in 2020. If you go back to 2019, 18, 17, no entries were through Sinai from Egypt, meaning that no African people came through Sinai to Israel in these years. And there's a reason that we'll talk about it later. You can see that the total number is almost 65,000 throughout the years. And right now they're a little bit more than 30,000. A lot of them left voluntarily. As you can see, voluntarily also is a problematic word to use, and we'll talk about that a bit as well. You can see other numbers of people that are not African in Israel, such as Thai and Filipinos and Nepalis that we talked about a bit. Number of tourists. And you can see the very small number of cases that were opened against employers of foreign workers, refugees, legal and illegal workers. I'm sure that you're gonna meet or hear or already heard about cases where employers treated wrongfully workers, either by firing them when they were pregnant, which is illegal, not giving them salaries, lots of reasons, and the number is so low, which is amazing. I would imagine that there were thousands of cases that should be opened against employers and indictments about that number as well. This link is to the ASAF site. It's one of the major organizations that work in Israel with asylum seekers and refugees. There's an English version of it. I mean, a lot of pages are translated, so I recommend looking at it and learning more. Questions before we continue? Okay, so a little bit more about the countries themselves that we started talking about it. I draw a simple map. I mean, like the journey that people go through when they leave Eritrea or Sudan into Israel. It's a certain direction. They can also go to Libya and try to get to Europe at the other direction, which is I think more common today. Also very tough and costly. I don't know how to say that. Costs life. That's the general idea of how they go through. We'll talk about. We can talk about it now. There are a lot of camps throughout the journey. A lot of them. Do you see my mouse? My pointer? Okay. So a lot of them are around this area, north of Sudan. Camps where refugees and asylum seekers that left Eritrea, or Darfur, which is here. If you heard of the name Darfur, it's this area. They stay here at Sudan before they get picked up by smugglers that take them through Egypt. Sometimes they're held in Egypt as well. Sometimes they stay at Egypt. Most of them that go to Israel stop here at Sinai. This is the relatively small area here, which is a big desert actually, almost the size of Israel, as you can see. A lot of camps are in Sinai. Some of them are torture camps. We'll talk about it later, which is also a horrific situation. So that's the journey, the general journey that they do. I'll say a couple words about the countries themselves. There's a lot of material about them, a lot of history. I recommend reading about them. We'll not finish if we'll talk about the entire history of them. But just a couple of words. Sudan, which you can see here, that today is Sudan and South Sudan, used to be a single country, has many wars, internal wars during the years. They've had a prime minister. His name was al-Bashir, I think. He was a bad dictator, led to many wars. There was a situation of Arabs against Africans in Sudan. The Arabs were prioritized about the Africans. Africans were banished from their villages and houses for the mines and the nature materials that were there. Wanted to make money of them. It led to many killings, many genocides of entire villages. And today, maybe a little bit more than a year ago, the government was replaced. That the dictator was, they moved him away in a military revolution. The one that took his place, which is supposed to be more of a Western guy, one that is open for talks and for peace, is actually one of his deputies, one of al-Bashir's deputies. He was responsible for the genocide in Darfur. He was the head of the military group that did what they did in Darfur. And also, I think maybe you heard in the news that in recent times, like 2 weeks ago, maybe 3 weeks ago, discussions between the Israeli government and the Sudanese government started to calm things down between the countries. I think that anyone that you ask that works with people from Sudan that escaped would say that discussing with Sudan is a good thing, and making a peace between the countries is obviously positive, but specifically the guy that is in charge of the country is a bad guy. So they're mostly afraid. There was a situation in South Sudan, I think in 2015, they declared independence, and maybe 2014, and just a couple of months after, lots of South Sudanese were sent back to South Sudan, before understanding the situation in the country, which led to additional wars inside the country, additional refugees that fled the country. So I think maybe 5,000 people went back to South Sudan. Most of them left again because of the situation in the country. So I think people are afraid of the same situation happening again in Sudan. So that's something that is happening now, and is very relevant. Eritrea, I didn't say Sudanese people are 20% of the refugees in Israel, something like that. Eritrea is the country that holds 20% of the refugees in Israel. Most of the refugees in Israel are from Eritrea. Eritrea is called the African North Korea. The dictator that leads Eritrea is also there for almost 30 years. His name is Isais Afwerki, a dictator as well. Eritrea, just for an example, is the country at the bottom of the table of free speech that is made by, I don't know the name of the international organization that rates free speech and press freedom, but they're always last. I think that we all know about North Korea and how it works there, or heard stories about it, so it's pretty much the same in Eritrea. Young people in Eritrea, when they turn 18, they're obliged to go to the army. Everyone, there is no um, dismissal date. I mean, you stay at the army as long as they want you. You don't get out at a certain point, like in Israel, which is a weird situation as well. You only serve for like 3 years. We can talk about if it's right or not, but Eritrea, you don't get out of the army. You just serve them as long as you can. And most of the time, the people in the army are workers. They build roads, they build houses for the rich people, for the government people. They don't see their family for years sometimes. If they refuse to work, they go to jail. They don't get out of the jail as well for a lot of years. So it's a very difficult country as well. I added Ethiopia because a lot of Ethiopian people are in Israel that are not Jews. Some of them are refugees, some of them are not. Ethiopia is a country that the situation is not similar to the ones in Sudan and Eritrea, but some areas in Ethiopia are also under conflicts. People escape from their villages and from their areas because they're being persecuted. So there are people that are refugees and there are people that are in Israel, but it's a more complex situation. It's not as straight as Sudan and Eritrea. We talked about the journey, and we'll continue to talk about the visa, and I'll show you how a visa looks like and what's the visa of an asylum seeker. The wall, we'll see that in a minute, that because of that, the number of people entering Israel is 0 now from Egypt. The deportation and the deposit law we'll also mention in a few words. Okay, no questions. A couple of photos. You can see a common African family in Eritrea, just so that you'll see how it looks. Pictures from Sudan and Darfur of burning villages. Just to have an idea, this picture is the wall that I was talking about. In 2005, I think, maybe 7, they started building the wall in Egypt, in Sinai, between Sinai and Israel. At the early 2000s, people started coming from Africa in numbers. It took some time and the numbers grew and grew, but it got to a situation of thousands of people passing through every month. And Israel decided to build a wall to make sure that people won't be able to come through the border. The border was just a couple of fences. It was very easy to get in. The Egyptian people, the Egyptian army, used to shoot people that try to pass from Egypt to Israel. So refugees that just ran for their lives. The minute they got through to Israel, the shooting stopped. So they understood that they're in Israel. And in 2012, they finished building the wall. And in the years after that, a couple of 10 of refugees, like 20, 30, 40, still came through every year, but it got to a situation that no refugees gone through the wall since 2017. So it actually worked for the government to stop the immigration through Sinai into Israel. It's an important factor to take into consideration when talking about the rights, in my opinion, the rights of refugees in Israel. I think that the common thing that the people that reject the idea say is that if you give refugees any rights, it'll cause more refugees to come into Israel. It's not the situation. I mean, I don't know if it's positive or negative, but the fact is that it doesn't matter if you give rights or not. People that used to come through Sinai, it's not happening anymore. And we're not talking about the people that are now inside Israel, and not about possible millions that could still come into Israel. This is a few protests that happened in Israel. The women protest that you can see here, that happened a couple of years ago. All of those are refugees, and a big demonstration that happened in Kikar Rabin in Tel Aviv, 2014, for refugees' rights. Throughout the history, a couple of main events happened that triggered the public interest in the refugee situation. The main ones were 2017, where the deportation plan came up. The government decided to sign an agreement with Rwanda and Uganda in order to deport people to these countries. I think it's one of the most racist plans that ever happened. I mean, it's like you take someone from, I don't know, Mexico, and decide to deport it to Spain because they speak Spanish, or because they look the same. I don't know. It's the countries in Africa are very different. So deporting someone to Rwanda while he's from Sudan is like throwing someone that speaks Hebrew into a place that speaks Norwegian. I mean, it's not even the same, although they have the same skin color. So it's a stupid plan, and it's not working, and it didn't work, and we're happy for that. But it led to many demonstrations. Two more big things that happen are the opening of Saronim prison, which is right by Nitzana. It's very close to the border of Israel and Egypt. It's a prison that every refugee that came through Sinai to Israel were held in for a couple of years at points, and for a month at these times. No one comes through right now from Sinai, so it's pretty empty, but it used to hold people for a couple of months, 3 months, 5 months, when they come to Israel. And it's a prison, basically. It's against the law, the international law. You cannot imprison a refugee that enters the country, even if it's illegal to enter the country, because that's what being a refugee means. So it's internationally illegal. And the second one is Cholot. It's a detention center that was open also at the south of the country. It's closed. It's been closed this year in March. But it helped people. It's not a prison. It was called an open detention center. People came in and out, but it's in the middle of nowhere. It's in the middle of the desert, and the people were supposed to sign sometimes 3 times a day. So it was basically a prison. But the High Supreme Court ruled it as illegal as well. So it was canceled. It was closed. Okay. You can see how a visa looks like. It's a temporary license. You can see that. I think that this. Now we're going to more of practical information about how health life for asylum seekers looks like in Israel. So if you have any questions about the theoretical material that we talked about, now is the time. Before we continue.
I have a question. So you were talking about sending them to Uganda and Rwanda not being a feasible idea because they don't share the culture, they don't speak the language. But isn't that the same thing as them being in Israel? They don't speak Hebrew, and they have a very different culture from those in Israel?
I think it's ask me again the question. I mean, you're asking if it's okay, if the situation of being in Israel and being in Rwanda is similar. I think the situation itself might be similar because they don't speak the language. The difference is that they I don't know if they chose, but they got to Israel themselves in order to escape a dangerous situation. They're not choosing to go to Rwanda or Uganda. They're being deported there illegally. I mean, no one is supposed to deport a refugee. That's the first point about that. The second is that actually going to Rwanda and Uganda proved to be a very negative thing. People that have gone through the process tell that the minute they get to Rwanda or Uganda, their documents are being taken. They're being imprisoned for a couple of months, then are thrown away from the country again. Ugandan people throw them to Rwanda, Rwandan people throw them to Uganda. So they're not getting a new life or a better situation by getting into these countries. It's basically, it's a bigger question, right? It's a question about the refugee situation in the world. What do you do with the millions of people that leave Africa and get to Europe or get to other countries? I mean, most of the refugees are actually in African countries that are right by these Eritrea, Sudan countries, right? So I don't think that the solution is just moving people around from one country to another, unless there is an international agreement that takes into account the situation in each country, the effort that each country can make in order to help the situation. I hope that answers the question.
Yep. Yeah. Thank you.
Okay, great. Anything else?
Can I ask 2 quick questions?
Sure.
First, I'm wondering what the Hebrew word for the infiltrator is. I never heard that before.
It's called mistanenim.
Okay.
And it's also, like, I think that it has the same feeling in English, right? Mistanen and infiltrator.
Yeah, negative connotation for sure. Okay. And then also just to clarify, did you say that the wall was built by Egypt or Israel?
By Israel.
Okay. Thanks.
Yeah, sure. It costs a lot, but I think that the purpose of it was fully made. I mean, it was a successful project by the Israeli government. I mean, they got what they wanted to get in a very efficient way. Okay, so this is the visa, as I said. It's a pretty old one, but it actually looks the same right now. You can see that it says conditional release. I mean, he has been released from Saonim at that situation. And if he does any crime, he's sent back. And just looking at the time. Okay, and you can see here that it says that this type of license is not a working permit. This phrase will cause a lot of issues to the refugees because it's actually a weird sense. It's not a working permit, but it's not saying that they cannot work. And for a few years, employers refrained from taking refugees to work at their place because they were afraid of that sentence until the government issued a clarification that says that they can work. So today, some of the visas still has this phrase, some are not, but it did cause issues sometimes. So this is how a visa looks like. You can see the 2A5, 2A5 type of visa. It's like the most basic visa in Israel. There are a lot of types. There is a 5B, 5A. I think that residents that are here, like if you marry an Israeli, you get a 5A, which gives you most of the rights that an Israeli citizen has. If you get a 5B, so that's a bit lower. Some of the refugees have 5B, meaning that they get some rights, like money for kids. Israelis get like a certain budget every month to take care of their kids. So 5Bs do get that. It's basically by chance. I mean, it depends on the situation of your family, the how hard you pushed to get a 5B. But most of the refugees get the 2A5 visa. That's the standard standard visa. Okay, we'll talk about the main topics in that concerning health for asylum seekers in Israel. We'll talk about the health insurance situation, the accessibility to health services, the awareness and cultural differences of the asylum seeker community, and the mental health issue. I think it's a very big issue. We're not going to be able to talk about all of them in details, but we're going to go through the main things. So the health insurance, according to the state health insurance law from 1994, that was it was I think Rabin who was prime minister when it was laud. I don't know how to say that, and it says that every Israeli citizen can have medical services for free, basically for free. You need to pay a couple of shekels every month, but it's basically for free, and it includes almost everything. It includes meeting a doctor, getting a surgery, getting your meds for a low price, going to the ER. It includes everything. There are private insurances. The way it works is that there are 4 kupot cholim in Israel. I hope that you know the word. I don't think that it has an English word, kupot cholim, like health funds or something like that. There are Mauchedet, Klalit, Maccabi, Leumit, which are 4 like companies that give you health services, and you pick either one of them. They have their advantages and different disadvantages. The biggest one is Klalit. So you get your health services through these companies. Foreign workers were actually in Israel before asylum seekers and refugees. And when they came into Israel, I see that you write on the chat, but I can't really see it. So okay, study for example, right? Okay, I'm stop looking. I won't look at it, and if there's something important. Okay. Because it's in the side, it's hard to see. Okay, but if there is a question or something, so let me know. Okay, so I was saying that foreign workers were in Israel and they needed some type of insurance. So the Israeli government decided that they're gonna make a law for foreign workers and their rights in terms of health. And it means that when you work for an employer, he is obliged to make an insurance for you. It's a private insurance. It's not, the government doesn't have any involvement in financing it. It can cost sometimes 50, sometimes 20, sometimes 80. It depends on the time that you're in Israel, and depending on your status. And it gives you most of the rights in terms of health services, meaning a doctor, going to the ER, getting a surgery. It covers most of the problems that you might encounter. Every worker has the right to get this insurance. If an employer does not make an insurance for his worker, he's doing an illegal act, and he can be prosecuted later. You saw the number of cases that were opened against employers. You saw that it's almost, I think, 80. The number of workers that are not being insured by employers is of thousands and more, I think. But I don't know the exact number, but we know that right these days, before the COVID-19, 50% of the workers from the asylum seeker community were not insured, and it's pretty cheap, but it's just a way of saving money on the back of
Can I ask a question?
Sure.
Is the reason why possibly because they don't want to expose these workers? Because if you provide them health insurance, you're putting them out there in front of the law and they might not get the job.
Well, it depends. If we're talking about specifically the African community, there is no exposure. I mean, it doesn't matter if the government knows about you or not. They cannot deport you as long as they don't check your request, and they're not checking requests of being recognized as refugees. So for them it doesn't matter. For Filipinos, for people from Nepal, for Thai people that decide to stay in Israel after the license is expired, it might be the situation. I don't know. I don't know how it works in that part. I do know that many times in many government institutions and offices, there is a separation between data that can be provided between offices to prevent situations that endanger people and prevent them from getting medical care in fear for being deported. It's also an international thing to make sure that people can get treatment and not being afraid to be deported. It was very important during the COVID-19 that the Ministry of Health came with a publication that no matter what your status is, even if you're supposed to be deported, and you have COVID, you need a test. You should do the test, and no one will know your information. You won't be deported for that test. But it's the general thinking of specifically about the health services. You can get health services without being recognized as the country and being deported. So it's an important thing that was done by the health ministry.
Thank you.
Sure. So we were talking about the fact that they need to be insured. And an important thing that I'm sure that you'll encounter in your work with asylum seekers is the topic of insurance continuity. When you get an insurance that is a foreign worker insurance, I wasn't saying that, but when they try to understand what to do with refugees and asylum seekers in terms of insurance when they were here, so they decided to include them inside the foreign workers law, just because they didn't want to make any law specific to refugees and asylum seekers. So they just included them inside the foreign workers law and made sure that employers will insure them if they work for them. So there's nothing specific for foreign workers, for refugees, sorry. Again, terming refugees as foreign workers is also a misdefinition. I think it's a very common definition for refugees, saying that they're foreign workers, that they came to Israel just to work. So putting them under this law is not a positive thing for them in terms of how people perceive the situation, but it's how it is. So the continuity is part of how health policies work in foreign workers insurances. As long as you work for an employer, you have the continuity of the insurance, of the things that you're entitled to. Say that you are working and then you're diagnosed with diabetes, you're diagnosed with a problem in your kidney, I don't know, something like that. Then you go to a doctor, you get a medication, and then you're being treated, and you stop working, you are fired, or you need to switch your work. If you find a job within these 90 days, that after you stop working for a certain employer and you get a new insurance, that everything that was diagnosed for you in your old job will still be covered in your new insurance. If you haven't been able to find a new employer that will insure you, that will do an insurance for you in these 90 days, everything is erased. So if you had diabetes, you still have diabetes, but it's not covered by the insurance company. So you need to pay for yourself. So it's a very frightening situation for asylum seekers, that when they are fired or when they leave their job, they need to find a new one in 90 days. It's like a clock that is ticking. And the coronavirus situation led to a major boost in that situation, in problems that are concerning that situation. The country was closed for 2 months at certain points of the first wave of the COVID. So a lot of people lost their continuity, a lot of them, and Physicians for Human Rights made an approach and appeal for the High Supreme Court in order to cancel the cancellation of continuity for workers during the COVID crisis, which is now being discussed, I think. But it's a major problem, and we run into it very often when someone comes to us and asks for help, and he has been fired or something, even if it's not health related, and he's saying, I was fired, and need help in getting my rights from the employer that fired me. I need the compensation money. So the first thing that we're going to say is you need to make sure that you find a new job and that they insure you. They make an insurance so that you don't lose your continuity, especially if you're sick in something. And there is a possibility to make the same insurance for yourself if you're not working for these 90 days, meaning that you can like pull the insurance with you from a worker, from an employer for 90 days. It's expensive. It's more than 200 shekels a month, but you can do it in order to keep your treatment going. If you're not working at the moment, you still need to find a new job in 90 days. Okay, so that's about the health insurance. The health insurance for tourists is another option. If you lost your job, you're not working, you haven't been working for 90 days, you're still not working, you can make yourself a tourist insurance, like every tourist in Israel. Like when you fly to another country and you make yourself an insurance when you're there. So it's the same. It's a private insurance. It covers not a lot of things. It doesn't cover most of the surgeries. It doesn't have a continuity, meaning that if you do that after a month, you need to re-register yourself for that insurance. So it's not good for chronic diseases, diseases. So that's a solution, but not a good solution. You can meet the doctor, you can go to the ER, but it's not a good solution. That's about the two options of insurances. And when you get a request, or when you help someone that doesn't work or doesn't know about the situation, or maybe he doesn't know that he's entitled for that insurance. So it's important to make sure that he knows that he has an insurance, that he knows how to use it. He knows that he needs to keep the continuity. A lot of workers employers don't know that they need to do an insurance for the workers, for the foreign workers, for the refugees. So it's important to raise the awareness for that as well. Child insurance is a bit different. The country understands that children are important, probably more than adults in their perspective. So there's a special arrangement through Mu'chedet, which is one of the Kupot Cholim. It's partly subsidized by the country. You can pay 120 shekels a month and do an insurance for your kid. 120 for a month for the first one, additional 120 for the second kid, and then above that, it doesn't cost you any more. I mean, if you have 3 kids, 4 kids, 5 kids, it's still 240 shekels per month. If you have a kid that has an insurance through Mu'chedet, you can make an insurance for yourself as a parent for 100 shekels a month. So people that are not working and have kids that are part of the Mu'chedet agreement, we recommend them to do an insurance for themselves as well through that, because it's cheaper and it's most of the same as a tourist insurance. It's a bit better than tourist insurance, but cheaper. So it's also an arrangement that adults use when they have kids that have insurance through Mu'chedet. An important point about emergency treatment, according to another law in Israel, since 1996, it's the sick citizen law, something like that in translation. And it says that every person, doesn't matter what his status is, if he has an insurance or not, if he's a person and he gets to the ER and it's an emergency, he needs to get treated. And people go to the ER and are getting treated. They cannot pay for the treatment that they received, so it's creating what is called ghost debts. There are a lot of debts to hospitals around the country that are not being paid. No one is making sure that people pay. I mean, no one will go to an asylum seeker and take their TV or their car. There's nothing to take, actually, most of the times. So these debts are just as they are. It's a lot of money. It's a well-known issue that is being discussed, but that's the situation right now. If someone comes to me and says, I don't feel well, I need treatment, if it's an emergency, I tell them, even if they don't have insurance, go to the ER, they'll treat you. And we see that most of the times doctors tend to treat patients in a more free way. Like, if something is not exactly an emergency, they might somehow say that it's an emergency, make it look like an emergency so that they could treat them. It's in the nature of physicians, of doctors. I think, I hope, is what we see usually, that people are being treated, even if it's not the most major emergency that you've seen. So it's a nice way of looking at it. I hope that I'm not lying to myself by seeing it that way. So that's about the emergency treatment. It's also about pregnant women when they go into labor. So it's also about, it's supposed to be funded by the Bituach Leumi, by
Social Security.
Social Security, exactly. So it's supposed to be funded by Social Security, you said. And it's about 12,000 shekels for a labor, right? That's how you say it. When it's not paid, it's a ghost debt on the hospital. And if you don't have an insurance, it's not paid. If you don't have, it's about being insured, actually. It's not about being a citizen. If you're not, if you don't have an insurance, so you're not being paid for that labor. And it's making the situation hard. I mean, when a woman comes to the hospital, and she's not just about to give labor, so she sometimes the financial guys in the hospital try to make her go to another hospital, or pressure her to pay after she gives labor, and it's a fighting situation for a lot of them. They're being pressed very hard to pay, even though they don't have the money. Sometimes they're being threatened that they won't get out of the hospital if they don't pay, which is illegal, of course. Sometimes there's been threatened that they won't get any ID for their kid, for the newborn, if they don't pay, which is illegal as well. But it's a situation that we run into sometimes. Okay, any questions? Okay, accessibility. So three main things that I think are important in accessibility issues to the health services. One is the thing that we just talked about, the no insurance situation. So people don't have an insurance, so they don't have any accessibility to services, to health services, and we often need to find ad hoc solutions, like doctors that volunteer to treat people. Physician for Human Rights is a good example for that. But also private doctors that are nice and that they think that it's important, so they help. In Jerusalem, in Tel Aviv, and everywhere in Israel. The language difficulties, which are a major issue, obviously. People that don't speak Hebrew, that don't speak English, they cannot talk with doctors, they cannot make an appointment. They need to see a doctor, but they need to make an appointment for it. They can't just come to the Kupat Cholim, to get to see their doctor, the family doctor. And if they don't know how to do it, so how do they make an appointment? They just come and try to make an appointment at the place, but then they meet the lady at the reception, and they can't explain what they need, and they usually get into a fight because no one understands the other side, and it's a difficulty. The health ministry founded the translation line that is supposed to help people, help the doctor talk with the patient during their meeting. It has the translation to Amharic, to Tigrinya, to Arabic. It's basically okay. It answers most of the needs, but it's not perfect, obviously. Living and employment conditions are also bad, and an issue. I mean, if someone is an oncologist patient, oncologic patient, and needs a sterile environment when he's going through chemotherapy, and he doesn't have money to rent his own apartment. So can he do this chemotherapy, or can he not do this chemotherapy? I mean, even if he finds a place to do it, he doesn't necessarily, he can't necessarily do that because he doesn't have the accessibility to proper livelihood that answers the need of that treatment. The same as employment conditions. People work 16 hours a day, 7 hours a day, don't have the time to go to see the doctor. The employer doesn't allow them to go see a doctor. So they're very weak at the place of work. I mean, they don't have the power that an Israeli citizen have in front of their employer. So it limits their accessibility to get treatment. Awareness and cultural differences. So it's a big topic, obviously, but the asylum seeker community often lacks awareness about the health insurance that they're entitled to when they work, the way that medical care system, how it works. I mean, when you need to make an appointment, if you don't know that you need to make an appointment, so you're not going to get treatment, and it takes time to learn that. It takes time to understand how you do it. Sometimes you just can't do it because you don't know how to do it, and you're not being taught or are given the tools to do that. I mean, even the most simple thing of it's more of an accessibility issue, but you have an app that allows you to see test results, and if you don't have the Israeli ID number that holds 9 digits, but you have the visa number that has 8 digits, so you can't enter the app and you can't see your test results. And it's so basic, but you just can't do it because you don't have an ID. Vaccination obviously is something that is not very common in certain African countries. Nutrition is a problematic issue, especially when you have low income in every society. And follow-up is not always being made appropriately, mainly because of awareness and cultural differences. The way that it works in Israel is different from the way that it works in Africa, in many countries. Obviously, it's a very general say, but more specifically, Sudan and Eritrea work differently in terms of health services and how things are working. Mental health, I'm trying to rush a bit because I don't want to make it too long. So the silent torture camps, we talked about a little bit. People have gone through very bad tortures when they've gone through Sinai, especially because of the situation that when a lot of people started going through Sinai, the Bedouins that live in the desert in south of Israel and in Sinai as well understood the financial opportunity that was given to them. They started smuggling people, and then they decided to kidnap family members. If a family was going through the desert and they saw a husband and a wife, so they would sometimes kidnap the wife, hold her in a camp, torture her, send the husband to Israel, help him go through the border, give the wife a cell phone, and make them talk every day. and let him, the husband, hear that she's being tortured, so that he will be in a hard need to pay tens of thousands of dollars, sometimes 10,000, sometimes 20,000. There's an amazing movie called Sound of Torture that you can see and learn about the situation. It's an amazing woman that left Eritrea and got to Sweden, and she's talking on the phone with people that don't have family or enough help to fund the ransom that is being required for them. So I recommend the movie. It's a hard movie. I recommend watching it not alone, if you can, except you need to see it alone. I can understand that, but I wasn't able to see it alone because it's a very emotional and hard movie. A couple of solutions that are being used in Israel. So there's the Physicians for Human Rights, and more specifically the Migrants and Refugees Department. They give services, health services to migrants, to refugees, to foreign workers, to everyone that doesn't have health insurance. They don't check his status. They don't see if he's legal or not, if he needs to be deported or not. They just give him services. There is an open clinic that they run in PHR, and it's open every day. Every day. Gives services in many areas. A lot of doctors are volunteers in the open clinic, from oncologists to pediatric doctors and everything. The Terem Clinic in Tel Aviv, in the central station, also gives services to the non-insured community, as well as a small clinic in Jerusalem, in Talpiot, which is a neighborhood in Jerusalem, but also is being run by Terem. Terem is a private company that gives mostly emergency services around the country, but they won a michraz, like a competition to run clinics for refugees that are being funded mostly by the government. Gesher and Root clinics for mental health. Gesher is almost closed and Root is still running, and they give mental health services for refugees and asylum seekers. Volunteering doctors and allied health professions that we work with, that we know personally. I go to Hadassah every day. I meet doctors. I talk with them. Some of them want to help. Some of them are not interested. When I have the opportunity, I see that someone is interested in helping, or I can see that his eyes are being opened when I say something about about JACC and about the volunteering work that I do. So I try to enlist him to the volunteering doctors. And a lot of other organizations are now health oriented, but work with refugees, which are ASAP that I mentioned, the hotline, ARDC, UNHCR, which is the International Organization of the UN, Kav La'Oved, which works mainly on occupational issues and topics, Mesila in Tel Aviv, Negev Refugee Center, which is probably more relevant for Ben Gurion students, HIAS, JACC, which is us, and many more. I think that this long list is a positive list, but it's a very depressing list, because the more organizations you see, the more it means that the government is not doing enough to help people that are in the country. So it's a sword with two sides, basically. COVID-19 is a very, very long story. Rebecca, you want to tell me how much you want me to talk about the other things, or do you want me to finish, or what do you say?
I think you can talk about COVID. I think it's important, and you're doing a great job. So.
Okay. Okay. So if you're tired, sure.
Sorry. What was the name of the clinic in Talpiot for refugees?
The what? Sorry.
You mentioned that there's a clinic for refugees in Talpiot. What was the name of it?
It's Terem. It's a clinic that is run by Terem. I can add some links at the end if you want to show you where you can find everything. I also added my phone number and email at the end, so you can ask me any question if you still lack any information.
Okay, thank you.
But it's there basically. Okay, so COVID-19 obviously changed a lot of things. The entire focus of daily issues turned to the basic being alive issues. A lot of health people that we helped with, making arranging appointments, going to the doctor, and helping them understand what is being discussed. Everything just went aside and was not discussed, and we just try to help as much as we could with food, with stuff for babies, and everything. Just similarly to a lot of societies in the country, in the country, and as well as in the world. And I think that a big movement from doctors was also seen. People neglected health issues because they were afraid to go out of the house, they were afraid to go to a hospital, and it led to many health issues being, getting more badder. And it is now backlashing at us, and it will continue to do that. People that were supposed to get the treatment, that were supposed to start the medicine. I just today I spoke with a guy that has a kidney dysfunction, and he waited a month, like 2-3 months in his house. He was in pain. He didn't know what to do. He was afraid to go to the clinic. He didn't want to get COVID, and he just got. Today, he met his doctor for the first time, and he got to a situation of 35% of kidney function. If we caught it a month ago, 2 months ago, maybe it would have been 60%, 70%, I don't know. But it could have been important for him. So it will most definitely impact what we see these days. The fact that people were in their houses, they didn't work, they were afraid, they needed money for food, they couldn't fund insurance for the kids, for themselves. Because they didn't work, they didn't have insurance. So it raises a lot of issues that we're gonna meet soon, or are already meeting now. And it changed a lot of things. I don't know how longer it will continue. I still can't believe that it's still here. Sometimes it's just crazy to think that we're still going through it. And we need to understand what we can do as long as it's here, and it might be here for a long time. So we need to understand how we make people do things that they need to do, how to make sure that people get the treatment that they need to get, how we get to the people that are afraid, that we don't know, and it's a difficult task. So that's generally speaking about COVID. And I just, as I said, just today I met someone that was directly impacted by the situation. So I don't have a great solution as any other else, I think, about how to improve the situation for people that are in their houses. We as JACC, as a community center that tries to help people in different areas, as well as other organizations that work with the refugees, try to approach the community, try to find major persons in the community in order to get to people. We do a lot of translation work of papers in order for people to understand what needs to be done. If the government issues an order to that you cannot leave your house and you don't speak Hebrew and you don't speak English, so how could you know? So Physicians for Human Rights, ASAF, we translate a lot of papers to Tigrinya, to Amharic, to make sure that people know what to do so that they don't leave their house and get a fine of 500 shekels just because they didn't know that they're not allowed to leave their house. It's a crazy situation. 3 short stories so that you'll have a feeling of what's happening. These are either failures that we had or success stories. I'll tell you in a few words about them. So the first one is a guy from Eritrea. which is 33 years old. He's been in the country in Israel since 2008, and he came to us with back pains. He was walking a bit oddly. He couldn't really move his right arm and leg. He moved them, but it looked awkward. He went to a doctor before he met us, which said, you have a problem in your spine. You need to get a surgery. And it might have been a good thing to say if you were an Israeli citizen that had insurance and had the possibility to go through a surgery. But in fact, to my opinion, it was a very bad thing to say. When he came to us and talked about that, we understood that it's going to be difficult to get him into a surgery. Financially, it's going to be hard to find the right finances and the right hospital that would take him. We tried to do that, but we decided by consulting with different organizations that we're going to start by trying to get him a non-invasive treatment. He started to do physiotherapy. We found a volunteer physiotherapist that worked with him. He met him once a week for a couple of months. But actually, the guy wasn't 100% invested in the physiotherapy, as I think everyone. I think like 90% of patients are not invested in physiotherapy. And especially when they hear that there is a magic solution of getting a surgery, that you go into the surgery room, you wake up the next day, and then you walk normally and you don't have back pains. I think that is how he imagined it. And we weren't able to find a place that he could be, that he can have a surgery. He tried physiotherapy for 3 months. He decided to quit. He didn't want to do it anymore. He cut contact with us for a couple of months. We tried to reach back with him to get in contact again. He did another 2 appointments with the physiotherapist. He stopped again. He decided that he has to do a surgery, and that if we can't help him, so we'll find another place to do it. And eventually he decided to leave Israel. He went to Ethiopia. We talked once after he left to understand how he's doing. He's doing okay. He didn't have the surgery that I wanted to get. It's one of the major failures that I think that I was involved in. I don't know if there was anything better that we could do. Obviously, getting a surgery was a better thing that we could do, but we couldn't get it. And it's depressing, but we did what we could do to help him. And that's it. That's the story about him, basically. The second story is about another guy, which is also M. He's 30 from Eritrea, and he came to us after he's gone through a work accident. He was lying in a JACC in a hospital in Jerusalem, and the social worker of the department in the hospital contacted us. She knew us from another patient, and he told us about this guy that was not insured, and he's gone through a work accident. He needs help. He can't walk alone. He needs kabaim, like the thing that you put like
crutches.
Crutches.
Kabaim,
Okay.
the crutches.
Yeah. Okay, so that. And just as a social worker, he's done in this hospital. We helped him as much as we can. He doesn't have an insurance. He didn't pay for everything. Just take him and help him, which happens quite a lot. And we met him and we talked with him, and we understand that he was working. And during on his way back home from work, he was hit. He was hit by a car at the side, and then he fell to a hole in the road, fell off his bicycle, broke his leg. And we started the process of helping him. The fact that he didn't have an insurance prevented him from being treated at hospitals at the time. The employer just didn't make an insurance for him. We contacted the employer. He made an insurance for him for a couple of months. At the same time, we served an appeal for the Social Security, which is how things work when you've gone through a work accident. They're supposed to pay for your for your health treatment, not the Kupat Cholim. So we helped him serve the papers. We applied for him. The worker was supposed to sign these papers and he refused to sign the papers. We try to, there's no reason to refuse filling the papers. It doesn't cost you anything as an employer, and it happens a lot just because people are afraid that in some way, if someone has gone through a work accident when they work for them, it will hurt them. It does not. Eventually, we managed to convince him to fill the papers. In the meantime, because at the beginning he didn't have an insurance, so we found someone that also would do physiotherapy with him for the beginning. Then he got the insurance and he continued physiotherapy. And eventually the papers were served, the appeal was approved, and he got a lot of money that is helping him treat himself, pay for the rent that he cannot pay because he's not working. He has been working for 6 months, so he couldn't get any money. So it paid a lot of his rent, helping get food, and he's now walking perfectly, doesn't need any assistance, back to work, situation is good, and he has a new computer also that he bought in order to learn new skills, maybe find another job that doesn't require him, that is not a physical job. So we managed to help him in a way. Last one that I'm going to talk about is the one that is still ongoing. He's a 32 years old guy from Eritrea as well, and he was diagnosed with colorectal cancer 3 months ago. He was working, didn't have an insurance. The minute that the guy found out that the employer found out that they had a cancer, he ignored him. He refused to acknowledge that he was his worker. He paid in black, so he didn't have any way to prove that he was working. So the connection to the worker was cut, and no help was possible from that angle. And it's a complex disease. He needed chemotherapy, he needed radiotherapy, and he was lucky. He got to Shaare Zedek at the beginning. They decided to help him without him being able to pay. He went through chemotherapy in Shaare Zedek for free. Made something like 8 appointments. The results were very positive. The Shaare Zedek oncology department contacted Hadassah Har Hatzofim, another hospital in Jerusalem, asked them to help with radiotherapy that he needed. And after a little bit of persuasion, they accepted him and they gave him radiotherapy for free as well. He's gone through radiotherapy, he finished the treatment, he's gone back to Shaare Zedek for follow-up with the first doctor that helped him. We then contacted a company that produces bags, stoma bags. I think that stoma is international, right? So he has, because of the colorectal cancer, he needs a stoma for both urine and feces. So it's a special bag that is expensive. We contacted the company that produces it. We try to see if there's any situation they can provide in these bags that are, you know, a bit malfunctioned, cannot be sold to regular customers because it has, I don't know, the tip of the pipe is a bit damaged. The bag looks bad, stuff like that. We were able to get in touch with a stoma nurse from that company that works in the company. She is amazing. She took him as her project. She gets him the bags, the additional equipment that he needs. He knows how to do it thanks to her. He has the equipment that he needs. Eventually, we hope that he will get back to work so that he can sustain himself. He will be with the stoma for all of his life. So he will need these bags, and he will need these glues and stuff that are needed to attach to the bag. So he will need a way to get money at some point, a way to get these bags and equipment in a regular basis. We hope that the company will continue in assisting, but we're not sure, obviously. And he was very lucky that he found the right people that can help him. And it's still ongoing. We're currently trying to help him find a job that will suit his needs. He cannot work in a physical job. He can't wash dishes. He can't clean, which is the most common working places for asylum seekers. This is the end. A sentence by Rudolf Virchow, which is a physician. He's considered the father of pathology. I don't know if you heard of him. And he's saying that the physician is the natural attorney of the poor. And I think it's a nice sentence. It has lots of meanings, and I hope that we can all be good attorneys. This is my phone number. This is my email. You're welcome to send messages, to consult, to ask questions. That's it. Any questions?
Guys, now would be a good time to ask questions about any of the presentation. I know for American students as opposed to Israeli students, sometimes it's hard to interrupt in the middle. So feel free to ask anything right now while you have, his attention.
Yeah, so I was just wondering, like a few years ago, there was talk about an agreement with Canada to absorb some of the refugees. Like, do you have any comments on that, or like if it's ever going to be revisited?
I think that I heard that you were saying that there was a program that the refugees were resettled in Canada. That is what you said?
Or there were talks about resettling in Canada and like sending many refugees there.
Yeah. So there were two main programs of resettling people in other countries, in Europe and in Canada. In Europe was made by the UN, and in Canada was done in a program that was like a sponsorship program in Canada, when you found someone, an individual or a group of 5 people or a company, 3 different ways of getting into Canada when someone decided that he wants to sponsor a refugee. It's still ongoing. I think that until 2 years, like in 2018-17, it was a very major program. Hundreds of people were going to Canada every year. I think that the record was something like 300 a year, but I'm not sure. Today it's a bit less. Obviously in the Corona it's much less, but even before that, end of 2019, it's been reduced, but still there is a chance. It's very hard to go to Canada. You need a very good reason, a very good advocate in Canada that decides to bring you to Canada. But it's still a possibility. Yeah, I think that a lot of asylum seekers, because of the situation in Israel, they dream of going to Canada. It's good to dream, but the reality says that not a lot of them will go to Canada. And even if they go to Canada, we hear stories about Canada being a better place, obviously because of the rights that they get, but not an easy place. So I've been talking about with several people that wanted to go to Canada and also that went to Canada, and it's always an interesting discussion about lowering expectations, even if they go understanding that moving to another country is difficult as well. The second program that I was referring to is the UN that was moving people to other countries in Europe based on mainly health issues, because they couldn't get the health care that they need in Israel, cancer, kidney treatments, like, when they forgot the name, but you need to filter the blood outside of the body.
Dialysis.
Yeah, dialysis, exactly. Other treatments that are not possible because they don't have insurance in here. No one is accepting them. So some moved. Another thing that the UN ran is family reunions in Europe as well. If your husband, if your wife got somehow to Europe. So they do tend to reunion families, but it's in small numbers. It's not a big thing that happens.
I have a question. So,
Yeah.
so one thing that has been interesting going from a place like Tel Aviv and working with asylum seekers in Tel Aviv to going to Beersheba is that all the resources that you generally use in Tel Aviv are now not there. You know, like in Tel Aviv, I could say, okay, I'm gonna, try to send to Gesher or something like that. And so I was wondering if you could mention how you deal with that in Jerusalem, which is, has less resources than Tel Aviv, and what your experiences have been with that.
Yeah. Okay. First of all, there are situations that there is no other option than sending someone to Tel Aviv. If that's, I mean, that's the last solution. If we don't have anything to offer, if we can't find something that can help, we contact organizations in Tel Aviv and we ask people to go there and get the training that they need. It's a solution that we sometimes don't have any other option. In terms of what we can do, so it's built a lot about relationships with hospitals in Jerusalem, knowing doctors, doing work in getting to doctors that can help. We did a lot of work in contacting physicians that can help pregnant women to do ultrasounds, to do a follow-up during the pregnancy to make sure that it's a good pregnancy. And we managed to find some doctors. So depending on the capabilities of whoever is volunteering, finding the doctors and the physiotherapists and the other professional help that can be found is important in my opinion. That is for people without insurance. That you need to find solutions for people with insurance, and it's a big part of the work as well. Is understanding the issues, understanding what creates difficulties in the system that is already implemented in Jerusalem or in Beersheba. As an example, if someone needs help understanding what he needs to do in order to get, like a hitchayvut, like an obligation from the Kupat Cholim that they will pay for something in the hospital. It's not easy, and I think that it doesn't. In Tel Aviv, you have organizations that specialize in everything. I mean, Tel Aviv is very. There is an organization that helps with employment issues, that with health issues, clinic issues, helping with going out of Israel, reunioning with families, and other cities like Jerusalem, like Beersheba, like Haifa, have these organization or organizations or individuals that do like all over the place. They help with health issues and employment issues and status issues, and they try to do everything. I think that the good thing would be understanding that you cannot help with everything. We at the JACC, we have some people that help with health, some people that help with employment, with status, and each and every one of us needs to understand what he can help with. If he cannot help with something, he needs to find the guy that can help. He needs to find a way to contact people outside of Beersheba or Jerusalem through email. A lot of the people are they're very accessible. They want to help. The help can be achieved through email, through the phone. A lot of the times it doesn't require the drive, the finding the right organization in Tel Aviv. And we try to find these ways to cut the corners, to find the ad hoc solutions, to get the right people to help that are not in our city. COVID in some way made good things for that in terms of making the connections easier. I attend this session because it's in Zoom. I mean, specifically it's different, but other sessions that would have happened in Beer Sheva or Haifa, I'm not sure that I could drive all the way there, as an example. So it's an example of how the connections are now easier in some way. So finding the right people, finding the right sources to get the help that can be achieved.
Thanks. Does anyone else have a question before we finish? Last chance. Okay, perfect. I did just, oh, go ahead, go.
When the situation you described in The Sounds of Torture, now that they know that, is anything being done? Can it be done? Given
about the torture camps?
No, but I mean about some of them being kidnapped on the way up, for example. What is happening around that?
Yeah, there's a lot of activity around that, mainly of the UN. They're trying to solve the solution. We can talk about possible solutions. What are the solutions? Attacking the torture camps, sending military into Egypt. The Egyptians are not very interested in what's happening there. It doesn't really relate to them. It's happening in Sinai. Sinai is, as you saw in the map, is pretty far from the rest of Egypt. So it's like a dead land of nothing in the middle of the desert. And it's mainly, it's not interesting enough for the European and the Western world to help these Africans that are being kidnapped. The UN are working to solve that. There is work being done. I'm not, disrespecting the work that they do, but
Not a lot.
Yeah, but bottom line, it's not helping, and it's still happening.
It's difficult. Thank you.
You're welcome.
Okay, if no one else has a question, I think that we're gonna finish. I did want to say, just for the sake of the recording, and because I know other people are gonna be seeing this that won't see the chat, and I have to, was that regarding the question about resettling to Rwanda. I did write a very long description in the chat, but for the sake of the recording, it's very important to understand that, first of all, refoulement is not legal in international law. That's kind of like the term used. So once you resettled at a first safe country, then you are not allowed to resettle in another country. Otherwise, you are breaking not only the 1951 convention, but several other conventions, which Israel is, by the way, a party to, and one of the first parties to, actually. And so, keeping that in mind, it's also really relevant to know that these asylum seekers who actually were, say, there was a few months where this was actually operational. And some people who were, for example, sent to Ethiopia or Rwanda didn't actually have papers, and so they were not able to find work, and they were not really legal in those countries. And some were sent back to Sudan, and there were cases where people were killed, and there was that popular case that I wrote about of a Sadiq, who was sort of saved by an Israeli humanitarian organization who was being threatened to be killed. So this is not a safe third country repatriation. This is sending someone to harm's way directly and being responsible for that. So I just wanted to make that very clear for the sake of this discussion. And I think with that, we can end. So I'm gonna stop the recording. And if anybody has any questions to me afterwards, I will